Good afternoon, and thank you for joining us. We called this emergency briefing today because we're certainly at a very critical time in our fight against this pandemic, and we couldn't really wait for the additional days to our normal briefings on Wednesday to share our concerns with all of you. For the past few weeks, we've been watching coronavirus cases surge across the world, certainly across the nation, across California, and frankly, right here in San Diego County. We've tried here in San Diego to emphasize the importance of taking preventative measures so that we don't get swamped by the growing second wave of cases. And for a while, we were succeeding in our daily case counts just as recently as 2 weeks ago. We were at 300 daily cases. But unfortunately, that surge is now here. We've seen that number steadily rise to 500, then 600, and yesterday a record 1,087 cases. But it's not just the rising case numbers. It's rising hospitalizations and testing positive rates. And now, as colder weather arrives, more people move indoors where the virus can spread even faster. And the holiday season is approaching and provides more opportunities for large gatherings. We understand that people are frustrated and certainly fatigued. We know that businesses have been harmed by these restrictions, but we cannot allow those feelings to weaken our resolve. Today, the governor announced that 41 counties in California will be purple, essentially the entire state of California. Those 41 counties represent 94% of our state's population. On Friday, I sent a letter to all the mayors in our region to have them step up enforcement of state and local public health orders. And our regional compliance team is moving forward on complaints that we are receiving. We need your cooperation, and we certainly need your compliance. But if not, we are fully prepared to enforce compliance with our local law enforcement agencies and other jurisdictions. This is not news that we want to hear heading into Thanksgiving. It's not good news any time of the year, but there are circumstances we are facing, and this is the world we are living in right now. We cannot cross the Rubicon and pass the point of no return. We either work together or suffer far worse consequences and potentially shutdowns. So with that, let me call up Supervisor Nathan Fletcher. He'll be followed by Dr. Wilma Wooten.
Thank you, Chairman Cox, and good afternoon. The challenges we're facing as a community as it relates to COVID-19 are not unique to us. They're not unique to California. They're not even unique to the United States. We are seeing significant case counts, increases in hospitalizations throughout the United States. And certainly what we are going through here in San Diego, while not unique, is concerning to us here locally. In just a few weeks, we saw the case counts increase significantly. The pace of the rise is of great concern. The situation becomes more dire as we see these significant leaps in the total number of cases we faced. We were having 200 cases a day, then it went to 400 cases a day, then it jumped to 700 cases a day. Yesterday it jumped over 1,000. Today, again, we're at just over 900, and this significant increase, not only in cases, but also an increase in the percentage of positive, is what gives us concern. We've talked since the very beginning of this about the significant lag between action, positive cases, and hospitalizations. We know there's between 21 and 24-day lag between a surge in cases and a potential surge in hospitalizations, which is why it's concerning that hospitalizations are also rising. The daily average of new admissions into our area hospital systems for COVID increased by 27% between October 25th and November 7th, a 2-week period. Given the slope at which our cases are increasing, we can expect to see further increases in hospitalizations in the coming weeks, which is why we have to take action now. Now is the time that we can come together as a community and reverse the trajectory. Now is the time when we can begin to recommit and refocus in an effort to try and slow the spread. Now is the time, as we move into the purple tier and the higher restrictions, that we have to limit those exposures and settings that we know are highest risk. We do not want to end up like so many communities we see across the United States that are having challenges in their healthcare system. Getting to that point only leads to more drastic and more restrictive efforts, and it also leads to greater economic damage to the total of the economy. And so the actions that we're taking are to avoid a situation getting far worse. As was mentioned around enforcement, we appreciate the overwhelming majority of folks that are doing things right, but in order to get our numbers where we need to go, in order to benefit the entire community, we have to ensure as best we can that there is enforcement. Over the weekend, our enforcement teams went out and investigated a number of complaints that we received in, and today we served 10 cease and desist orders to a variety of settings throughout San Diego County that are in willful and blatant violation of the public health orders. We will continue this effort, not out of a desire to be punitive, but out of a desire to ensure consistency with the public health orders, to slow the spread, lower the case counts, and provide an environment where we can get businesses back open. We also will continue to fight every day to be on the side of public health, to be on the side of doing the things that we know give us the greatest opportunity to reopen our business, to take action to try and help facilitate students getting back in school and moving forward. We're also aware we live in an era of great misinformation and disinformation, a very divided country. That's also not unique to us here in San Diego County. But whether your focus is opening business or saving lives, we ought to be doing the exact same thing, and that is slowing the spread, bending this curve, getting ourselves in a more solid position, and so we will continue to do that. On a positive note, we have seen really encouraging information in the last few weeks around what appears to be the viability of the vaccines that are in production. That does not help us today, but it does give us a sense as a community that what we're going through right now will not last forever. It is difficult. It is straining. It is having impacts on businesses, on healthcare workers, on teachers, on parents, on seniors. It's having impacts on everyone. But the amount of time we think we're going to go through this, we can see a pathway to a vaccine and where we go, but it's not here today. And so for today, and certainly it looks like through the end of the year at least, we're going to have to sacrifice. We're going to have to continue to come together. We're going to have to continue to fight each and every single day in an effort to try and slow the spread, to keep our region in a solid position, to avoid more severe consequences, and to set the pathway to come out of it. And we're going to continue to try and do that each and every day. And we ask for the public's help as we go through this. Public health orders and enforcement can only do so much. As a community, we have to make a decision that we are going to come together and do what we need to do. That concludes my update. I'll now turn it over to Dr. Wooten, who's going to walk through some case numbers, hospitalization, and give other types of general public health information. Thank you.
Thank you, Supervisor Fletcher. I don't think that it is any mystery why we are here today and why we called this press conference. Exactly 1 month ago, if you can show the first slide, we sounded the alarm about the possibility of entering the purple tier. And last Tuesday, we confirmed that we had transitioned to the state's most restrictive tier. We had hoped that the warning would mark a change in the public's personal and collective behavior. It is quite obvious, however, that it did not. Yesterday, the county reported nearly 1,100 cases. In the next slide, the highest number of cases ever in a single day, and as you can see it on the far right of this slide. These are the number of daily reported cases, again with yesterday being the highest number of cases reported to date. And today's number of 833 is the second highest number of cases. So keep in mind, just 4 weeks ago, from October 11th to the 21st of October, we averaged about 300 cases reported daily. And again, you can see where we are now, 3 times that number. In the next slide, this slide is just honing in down on the last 2 weeks. And again, you can see that we are gradually increasing, again with yesterday at 1,087 and today at 833. In the next slide, so today you will see that we find ourselves in the purple tier, and we have ample company. California is now a sea of purple, going from 13 counties last week to 41 counties this week that are in the purple tier. And I recognize that our place in the purple tier is frustrating to everyone. But remember, we aren't assigned a tier out of nowhere. We earn our tier placement. Please know that you have a say in our case rate and testing positivity. You have a say in our tier placement, much more than the state, much more than Californians who live in other counties. Over the last weeks, we have seen the results of what can happen when we relax our personal standards and let our guard down. We are in an emergency situation. COVID-19 is not going away, and we must act. We must act for our own health. We must act for the health of our family, our colleagues, and our friends. Act for the economy, and just act, and act now. This is urgent. In the next slide, I reported that today we had 833 reported cases. While this is lower than yesterday's number of cases, it is still, again, the second highest number of COVID-19 cases to date. These numbers are a reason for alarm, whether nearly 1,100 or over 800. They are just too high. Understand that you are taking action not because I ask you to do so, but because the different entities that comprise the vital fabric of our community need you to take action, and it's just that simple. Now, we all know what to do, and we talk about these every time we come before you. COVID-19 stops with you. Please do your part to ensure we slow the spread of COVID-19, and we cannot afford to waste another minute. In this next slide, it provides the preventive measures. Actually, I want to, yes, skip to this slide. Again, we encourage you to wash your hands and implement sanitation strategies. Stay 6 feet apart from others. Wear your facial covering. When you leave your place, cover your face. Avoid large crowds, and we certainly believe that this has been one of the driving forces, even though there have been many conditions that have contributed to this increase in the number of cases, not only in San Diego, but throughout the state and throughout the nation. We encourage you to stay home if you are sick. And by practicing these strategies, it can help decrease the testing positivity as well as decrease the overall number of cases. Now, finally, regarding, I know there are questions about our adjudication request 2 weeks ago. This was a moment in time for the period of October 18th through October 24th, with, again, at that time, no specific sector responsible for the increased number of cases that pushed us over into the purple tier. But we wanted to make a case to the state of just that. Today, the numbers are extremely and much more high than were experienced 2 weeks ago, and in a short period of time. So action is recommended and necessary at this time. The actions that have been recommended by the state, we are in support of those actions because they are needed at this time to drive our numbers back down. In terms of compliance, we have implemented many strategies since we moved into purple. As the health officer, I've written letters to law enforcement from the 18 municipalities to support the efforts of complying with the health officer's orders. So we appreciate the support from our local jurisdictions to that end. So again, in my last comment, everyone has a role to play, and we hope that everyone plays their role so that we can have a collective impact. Light is at the end of the tunnel. As Supervisor Fletcher mentioned, we now, as of today, there are 2 vaccines that are on the horizon. So if we can just hold on for the next 2 months, we will definitely see light at the end of the tunnel. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. Let's go to our first question.
The first question will be from Miriam Rafferty with the East County Magazine.
Yeah, hi. Thank you very much for the information today. Here in East County, we are seeing a lot of non-compliance, some of it from entities where we know the county tip line was called in ahead about entities that had publicly stated they were going to defy the orders, including, for example, a mega church, Skyline Church out here in the unincorporated area. Our reporter went around over the weekend and found mega churches open with people inside, no masks. He found, restaurants openly defying this with people inside eating. Some of them in the city of El Cajon, where the mayor has said they've told their police to make enforcement a low priority. So I guess I have a 2-part question. One is, why can't something be done if you know ahead of time that someone's planning a large gathering, like, say, at a mega church, instead of just letting it happen and then, I don't know if anything was ever done, if they got one of those letters or not, but why not do something to prevent the event from occurring in the first place if they have to, padlock doors or something? And secondly, what, if anything, can you do if a mayor of a city or a police department in a particular city is simply taking a hands-off approach and not enforcing? And I will add, to me, this is personal. My daughter works in a COVID ward at a hospital that's running out of personal protective gear. She does the most dangerous job of intubating those patients with COVID going on to ventilators. And, like many people out there, I think our family is terrified of this thing. And we just want to know what more can be done to, how is it fair to the many businesses out there that are following the rules, the many churches and businesses that have shut down, when they see open scofflaws just, ignoring the rules and seemingly, in some cases, getting away with this?
Well, there's a lot of questions there, and we'll try to respond to all of them. Obviously, our goal up to this point has been to educate and to encourage people to comply with the public health orders. We know now that we've got to take a much stronger position in regards to enforcing that compliance. We are doing that, and I know we have a couple of individuals that will speak in response to that. First, Supervisor Nathan Fletcher.
Thank you for the question. We know and share the frustration, not only that you expressed, but the frustration of businesses out there that are following the rules and complying, but yet oftentimes have to pay the consequences for those entities that don't. The simple reality is we are moving faster to get out to cases. I think some of the cases you probably referenced are things where we had folks out this weekend. Again, we issued a series of cease and desist orders today, and we will continue to move aggressively and swiftly for those entities that are in clear violation of the public health orders. As it relates to what we can do as a county beyond issue a cease and desist or a public health closure notice, that is where we do need the cooperation and help of law enforcement in the jurisdiction where the violation has occurred. If you have a situation like El Cajon where the mayor says we're just not going to do it, well, there's very little as a county that we can do beyond the things that are within our control and power. The inconsistent enforcement is something I think that is negatively impacting our region in terms of having the ability to have widespread compliance, and the continued efforts to say that there will be no enforcement when we see cases increasing, hospitalizations increasing. All of these metrics is again of great frustration, but we can only control what we control as a county. And that's our ability to put in public health orders, to go out and investigate violations, to issue cease and desist and public health closure notices. Beyond that, we do need the help and cooperation of law enforcement within the jurisdiction where the actual violation occurred. And we will continue to ask them for help. We will continue to push, and we will continue to do everything we can countywide.
And just as a follow-up to that question, starting tomorrow, we will be listing those businesses that have been issued cease and desist orders in non-compliance with our public health orders. So those will be on our county website. Next question.
The next question is from Brandon Lewis with CBS 8.
Thank you. Just to follow up on that previous question, have other cities, incorporated cities, also expressed that they will not be enforcing the public health order? In other words, what has been the response to the letter sent by Chairman Cox and Dr. Wooten? And my second question is to clarify whether the county could, if it wanted to, take any more restrictive measures than within the purple tier, so just targeting the workplaces and home gatherings where these cases are happening, and is choosing not to take any more action.
Okay, I haven't heard any responses from the mayors to that letter that went out on Friday. Obviously, we do know the situation in El Cajon. I'm not sure what the other 18 cities are going to be, 17 cities are going to be doing. I know I was talking with the mayor of, or texting back and forth with the mayor of National City. They certainly are going to be working in hand with the county of San Diego to bring about compliance in their city. You know, if we need to, we will issue a cease and desist order. If that is not effective, we can actually go in with a closure order to those businesses that are not complying. That's obviously a last resort. We don't want to do that. Our whole goal all along is to bring about compliance, and we're going to continue to work in that vein. Let me check and see if any of my colleagues have any additional comments they want to make. Okay, does that answer your question?
It does on the first part. And the second, just to clarify again, can the county take any more restrictive actions against workplaces and home gatherings where it says cases are spreading under the purple tier or beyond what's in the purple tier?
Well, if it's in a private home, certainly law enforcement could be called upon to go out and tell them that they're in violation. They could be issued a citation. At that point, it probably would be something that would ultimately involve a court hearing. And let me make sure that I'm on same grounds there. Okay, they're nodding yes. So does that answer the question?
Yes, it does. Thank you, Chairman.
All right, thank you. Next question.
This next question is from Paul Sisson with the San Diego Union Tribune.
Thank you. I wondered, with case rates now climbing, above 1,000, it's pretty eye-popping. What is the next step in terms of going back to a full stay-at-home order? Have you guys set any kind of threshold for what kind of sustained case rate you need to see in order to just lock everything down again?
I'm going to let Dr. Wooten respond to that.
Paul, thank you for the opportunity to clarify. The stay-at-home order actually technically has not been lifted by the state. They issue their respective guidance and information about going for a county to go from one tier to another, but technically they have not lifted the stay-at-home order. So right now the state is, and as you heard by the governor today, that we are on an emergency break from the tier framework. And basically, given the fact that the majority of the state is in purple, essentially that's what we're doing, maintaining the purple or having all counties, even those that are in other tiers, act as if they are in a purple tier and operate under the guidance for that respective tier. But again, there is a freeze on moving from one tier to another at this time until further guidance from the state.
Sure. That's all semantics, though. In terms of your community that you're overseeing and making recommendations for, is it hospitalization rates? You have the authority to be more restrictive than the state. Do you intend to do so if you see, say, hospitalization rates or some other metric climb to a certain level? Have you thought about when you would take such an action?
Again, Paul, technically, we are under a stay-at-home order unless you are going out for essential services or other activities. Technically, we are. Now, certainly, the entire state, not just San Diego, can reactivate or re-emphasize that particular health officer's order that is currently already in place. So it is in place in San Diego because we are implementing the state's health officer's order. So I can't be much more clear than that. Certainly, if things continue to advance into the wrong direction, we have other tools that we can utilize, particularly with hospitalizations. That's why we have our triggers dashboard, so that there are actions that we can take based on whether or not those triggers go below the threshold that we've identified. Thank you.
Thanks.
Just briefly to follow up on that, that's what we're trying to avoid. The reason that we're taking the actions we're taking, not only in the purple tier, the actions around enforcement, the actions around continued awareness of the severity of the increase in cases, is out of a desire and hope that we can bend this curve, that we can slow the spread, and that we can avoid being put in a situation where counties are forced to make more significant impacts and closures. So, you know, if you go back to June and you look, obviously there were more restrictions put in place. We want to avoid that. We want to avoid all of that. But in order to avoid a more severe situation, then that's why we are trying to do everything we can now to get as widespread adherence as possible.
Thank you.
Okay, that completes our call-in questions. We'll go to the first texted question.
And this one is from Abby Alford with CBS 8. She's asking, what 10 businesses were issued cease and desist letters for what specific violation, and what are the next steps?
Okay, starting tomorrow morning, we'll have all of the cease and desist orders that have been issued online and what those specific violations were. So we'll be able to provide that information tomorrow morning.
This next text question is from Andrea Lopez with the Union Tribune. Business owners as well as local officials such as Supervisor Desmond and El Cajon Mayor Bill Wells are calling for local officials and the governor to allow businesses that are not responsible for outbreaks to remain open. What does the county have to say to such a request?
Well, you know, we have 5 supervisors, and each one of them obviously have their own opinions on all sorts of different issues. But as far as I'm concerned, speaking as one supervisor, we have an obligation first to protect public safety, and certainly just as important to me is to protect public health. We have state orders, public health orders that have been put in place by the governor and by the public health director for the state of California. We have public health orders that have been put in place by our own public health officer for the county of San Diego. I certainly intend to follow those public health orders. We certainly hope that the elected officials throughout San Diego County would realize that this is a very serious situation we find ourselves in, and basically abide by those things that they were sworn in to uphold. And we certainly hope businesses, we understand the frustration, we understand the impact it's having on their livelihood and on their businesses, but we have a much bigger issue we're dealing with right now with this pandemic. And I think we are getting closer to being in a situation where we'll have a vaccine that'll be available. How quickly that is, we don't control, but it certainly won't come quick enough. But in the meantime, we certainly hope that the citizens of San Diego County, the businesses in San Diego County will comply with not only the county of San Diego's public health orders, but the state of California's. That's our obligation. That's what we were sworn into office to do. And I would certainly encourage all elected officials and all businesses to comply with those public health orders.
This next question is from Claudia with Univision. Based on the record numbers and dates, does it seem that this is a result of gatherings that might have taken place on Halloween? If so, with the holidays around the corner, what specific recommendations do you have to avoid the spread of COVID-19?
Okay, I'm going to ask Dr. Wooten to respond.
Thank you for that important question. So Halloween was exactly 2 weeks ago from this past weekend. That's, again, 2 weeks. The increased numbers that we are seeing now are not just from those, whatever gatherings occurred. But we do believe that our increase in numbers are due to people again, not doing the things that we recommend that they do every time we come before you with this press conference. It is really about wearing facial coverings and the social distancing and staying home if you are sick. I can't be more plain than that in making those recommendations. It is very important, though, as we go into the Thanksgiving holiday, we know that people want to get together, but I encourage you to follow the guidance that we have posted on our website, that the state as well as the CDC are recommending. Really limit your engagements or gatherings over the holidays. Follow the guidance from the state, no more than 3 households. I would strongly encourage you not to travel out of state, because that is an opportunity to pick up the virus and bring it back, or if you might be asymptomatic and infected, taking the germ or the virus to your loved ones. And certainly we don't want to have, I don't think anyone wants to have that guilt on their conscience if that actually occurs. We've heard too many stories about families losing loved ones. In Texas, a 4-year-old lost both parents to COVID-19. So please act responsibly and act smartly. Stay at home during the Thanksgiving season and follow the guidance from the state. Thank you.
Dr. Wooten, this next question is from Nelly Cervantes with El Imparcial. She's saying that she's remembering that a few weeks ago we were reporting patients from Imperial County that were being treated here since their hospitals were overwhelmed. Are those cases summed up with ours, or are they counted separately?
Those numbers are very small and certainly not responsible for the increase or ration numbers that we are seeing locally. Local hospitals have, in San Diego, have relationships and contractual relationships with other hospitals in Imperial County. So again, those numbers are not a significant contribution to the increase in number of cases we're seeing locally.
Dr. Wooten, this last text message question is from Lori Weisberg with the Union Tribune. She wants to know why we are not releasing the cease and desist orders today. Does the public know to deserve that these businesses are being served today, if nothing else, for their own health and safety?
I'm not sure I heard the entire question. We have Vince Nicoletti, who's the lead for our compliance team here. But businesses were assessed over the weekend, so any cease and desist order that's issued today is as a result of assessments over the weekend.
Thank you, Dr. Wooten.
As a follow-up to that last question, because of the public interest in regards to people that may be in violation of the public health orders, the cease and desist orders that have been issued will be on our website starting tonight. So we'll get that information out as quickly as we possibly can. That completes our questions for today. As of now, we're not planning on having a briefing on Wednesday, our normal briefing time. However, we will schedule briefings this week if there are circumstances that have changed that necessitate an update to the public. With that, we say please continue to stay safe, and thank you for your attendance.